I am Dr. Rajiv Agrawal, Senior Director, Breast Services, Medanta the Medicity Hospital, Gurgaon. Today I am going to talk on one of the most common symptoms related to breast, and that is breast pain. I think maximum number of patients that we see in our OPD is of breast pain. In the very beginning, I will like to reassure all of you that in almost 95% of cancers, there is no pain. What I mean, if a patient comes to us with a primary symptom of pain in the breast, probably she is not going to have a cancer. That is what I want to reassure, that if you are having a breast pain, do not panic. But of course, if there is a pain, consult your doctor, and particularly a doctor who knows about breast pain very well. Coming to your symptom of breast pain, there are three types of breast pain. One is a cyclical breast pain, the other is a non-cyclical breast pain, and of course the third is extra mammary pain. Cyclical breast pain, I mean when a lady is about to go for menstrual cycle, 3, 4, 5 days before the pain starts. It may be mild, it may be moderate, or sometimes it may be severe. But once the period starts, in most of them within the next 2 or 3 days, this pain subsides. So this is just a sort of what we call as exaggeration of the normal physiological phenomena. This is not a disease and there is nothing to panic. Once I describe all three pains, I will be talking about the treatment of all these things. The other is a non-cyclical pain, which is a pain which may occur any time of the cycle or may persist throughout the cycle. There may not be any definite cause sometimes, or there may be some cystic lump. Cystic lump means fluid-filled lumps within the breast that can cause pain. Of course, any infection, any abscess, mastitis, specific infections like granulomatous mastitis, patient may present with pain which is non-cyclical in nature and definitely needs some sort of treatment. The third is extra mammary pain, which is not in breast, but it may be a chest wall, in the ribs, it may be a sort of sometimes esophagitis, sometimes pleurisy. Patient may think it is a breast pain, which is not a breast pain. So coming to the evaluation and management of various types of breast pain, the cyclical breast pain occurs in younger women during the fertile age group and particularly less than 40-45. Since it subsides of its own, the most important treatment for cyclical breast pain is reassurance to the patient that there is no gross disease. Of course, if the pain is severe, sometimes hot fomentation or mild analgesics may help the patient. Once the period stops, the cyclical breast pain is not a problem. Non-cyclical breast pain may be in one breast, may be in both the breast. Sometimes it may be a pinpoint pain. So once the patient comes with a non-cyclical breast pain, depending upon the age, we have to evaluate these patients. If the patient is less than 40 years, we should do an ultrasound first. If the patient is more than 40-45, we should do a mammography first and maybe followed by sort of ultrasound. If there is no gross pathology, if there is no lump, whether fluid or solid lump, then again these patients need to be reassured that there is nothing to worry. That is the first thing that we have to reassure the patient. Sometimes some drugs like evening primrose oil and vitamin E, though they are controversial, the literature says they are more placebo, but in our clinical practice we have seen that they are effective in most of the patients, particularly from moderate pain, because as mild pain I said it does not need any treatment. Sometimes these evening primrose oil and vitamin D does not help, then we have to give a drug called Danazol, which is effective almost in 90-95% cases. But Danazol has got its own side effects, little irregularity of the period, maybe weight gain, maybe change in the voice. So we should be very cautious in advising Danazol and should be given in the lowest possible doses, because the aim is to get the pain relief. If the lady is pregnant or wants the family in the near future, Danazol should not be advised. In very rare cases, when even Danazol is not effective, there is a drug called tamoxifen. The tamoxifen is a drug which is commonly practiced for estrogen positive, receptor positive cancer breast patients, and we are using this drug for almost 45 years. But in refractory cases where there is pain is not subsiding by Danazol or any other means, tamoxifen has been advised to give in about 10 to 20 milligram per day, and it is effective. The extra memory pain, we have to find the cause and treat accordingly. If we are convinced that this pain is not arising from breast, then we should have a detailed study, maybe a relevant investigation, and diagnose it. My take-home message is that breast pain is not a matter of worry, it may be a matter of concern, but not worry, and should be treated accordingly. And in most of the patients, we can treat it effectively and properly. Thank you.